Hey everybody, Dr. Ed Gigliotti here. Today, I'm going to go over the anatomy of the upper cervical spine and show you why it's so important to make sure that this is in good shape for your health and the people that we love. And then on top of that, what can happen when there's an upper cervical subluxation and the direct effect it has on this anatomy. So, as you know, upper cervical chiropractors, we focus on the upper neck. So the top three bones in particular, a lot of times it's the skull, atlas, C1, and C2, the axis. We don't just get out of school or we're in school and just say to ourselves, you know, that looks like a fun part of the body. Let's just focus on that. The reason why upper cervical chiropractors devote their life to this area here is because of the anatomy or the tissue inside that area. The lowest part of the brain is the brainstem. So you have the brain that's protected in your skull, and it's got to come out of there, right? So it funnels through to a stalk about this thick, okay? And this is it here, and that's called the brainstem. So the brainstem is like highly organized and highly dense with neurological tissue, with all the nerves. It literally funnels through, and it stalks, and it comes through that stalk there and supplies every cell, tissue, organ with the information it needs to sustain life, to promote health, for adaptability, everything. It's all about the central nervous system. If the central nervous system isn't functioning, we're not alive. It's that straightforward. Super important. So not even diving into the nerves, but let's first look at blood flow in the area that comes through these top bones in your neck. So I'm going to zoom in here. All right, so obviously you see the ears here, so you know what we're looking at. There's the brain. Lowest part of the brain, the brainstem, comes to here, which with most people comes to about the C2 vertebra. Atlas for sure, the lowest part of it, but sometimes to like the C2 vertebra. All right. Now, here we're going to look at the blood flow. Check out this here. This area here, these are the vertebral arteries. So these arteries come directly and indirectly from the heart and then come up the sides of the vertebra, and they're protected in the bone called the transverse foramina. These are little holes where the arteries just travel through. The artery travels through. And then it goes through the back. Once it gets to the atlas, it goes backwards and then up through the back of the skull, the opening of the skull. Okay? So, over here. All right? That artery is so important, or those arteries are so important, the vertebral arteries, because they supply the back 2/3 of the brain, like the back portion of the brain, supplies over 2/3 of it with blood. Now think about how important blood flow is. Now think about how important blood flow is to the brain. So what would happen if there was any vertebral misalignment? So any of those bones, which you know upper cervical chiropractors devote their lives to make sure in the proper position. Let's say a slip or a fall torqued it out of position. Do you think that would reduce the blood flow or improve the blood flow? Pretty straightforward, right? It's like kinking a hose. So now let's focus on the anatomy. So when we're talking about the nerves. So this here are the cranial nerves. So what's really cool about the brainstem is that it's like a relay center. I like to think of it like a fuse box in your house. All the power comes in, goes into the fuse box, and then it gets broken off into the different sections where it has to go. Well, in the brainstem here, this would be the brain looking from the bottom up, okay? This is the brainstem here. That was what would be coming through the upper cervical spine. All the cranial nerves pass through this area. If you're ever bored, just look up cranial nerves and brainstem. Just Google search those two words and look what you find and look at what they control. It is mind-blowing. Okay? So everything from eye movement to your vision, cranial nerve 8. So it's like, for instance, it goes from the nerves go from your eyes to your brainstem to the back of your brain. So they relay in that brainstem, okay? So vision's affected from there. Your smell, your face sensation and like if you get tingling or anything like that or pain is all from there. Your vagus nerve, which is really cool. Look up cranial nerve 10. Vagus nerve science is really obsessed with. It literally controls every organ. So every organ in your body, in your trunk, in your abdomen, other than your adrenals. So you're talking about heart function, digestion, lungs, so on and so forth, kidney, liver function, all has direct connection to this vagus nerve. It's like it comes down off that brainstem like a web. It is so cool. Okay? List goes on and on. Now, one thing I want you to focus on, because I'm going to show you a CBCT of somebody who has an injury, and what's being affected in their life. But the vestibular cochlear nerve, it's cranial nerve 8. This nerve, okay, comes out at the brainstem level, and it controls hearing and balance. So a lot of people, if the body is showing symptoms of an injury at that nerve, okay, and you don't always need symptoms for there to be a physiological injury, but if it is, it can be shown in like balance issues, vertigo, tinnitus, like ringing in your ears, hearing issues, things like that, okay, even nausea. So check this out. Just remember that. And are you guys understanding on why it's so important now, this anatomy? This is why we're so hyper-focused on this. Check this out. This is someone that just started care here, that we were just blessed to get images on. So this here is a view from behind. Okay, so the back of their skull, their jaw, their atlas, and their neck. This person's been reporting that they're struggling with like anxiousness, anxiety for quite a while now. And it's like debilitating when it occurs, these bouts of it. Hearing issues like tinnitus or tinnitus, ringing in the ears, and then also nausea. Can't get a solution to this. They don't know what's going on. Medical professionals are stumped on it also. Check this out. I'm going to get right to the meat and potatoes on this. We look from the top down. So now we're going to look through that top of that brain. So we're going to come through that skull. So we're going to come through this area here. We want to see on how the atlas, right here, how that skull is sitting on that atlas. This is it here. So this would be the back of the skull. The left ear would be here. The right ear would be here. This is looking from the top down. This is the rim of the atlas. That is what that person and your skull is sitting on, that top bone, the atlas bone. You should see symmetry here. Can you see on how you could see the whole rim of the atlas here and then the bone here when you follow it here? Can't see any of it. Now I want to show you this. This is with the skull off. So that's the same view, except we just took the skull off now. And you can see that the bone, the atlas bone, is very symmetrical. It's the same from left to right. But look when we look back with the skull on. Look how much the opening of the skull is to the left, where it looks like everything is shifted over. Even this is the back of the second vertebra, the spinous process of the C2. And that's this here. And look how much that occiput is set off. Isn't that crazy? So when you are talking about health, you're talking about life. If you had an injury like this, or somebody's walking around with an injury like this and doesn't know, think about how it's affecting their life negatively. From every physiological function to blood flow going to their brain, to all nerve function going to and from the brain. This is no small thing. This is why it's such a big deal that we tell our friends and our family about this care, because I'm telling you, this can be corrected. We can follow up with imaging on this after very gentle and specific adjusting, because this was probably a big trauma that knocked this out of place. It could have been a slip, a fall, car accident, could have been cheerleading, gymnastics, football. Who knows, right? Sometimes people know what it was. They remember, but sometimes they don't. Life happens, right? It could be a birth injury from when they're pulling on the baby's head and neck. But if this vertebra misaligns like this, and it stays in that mouth position, from that point forward, it's like trying to water your grass with a king toes. Nothing you do to that grass, from fertilizer to a new nozzle, anything will solve the problem until you get that physical pressure off of that hose so that water can flow. When you're talking about nerve function and blood flow, it's so much more important than watering your grass. We need to share this message. This is why we're so passionate as upper cervical chiropractors and why we devote our life to this work. A lot of us upper cervical chiropractors, myself included, this work changed our lives, which is why we put our heart and soul into this work. Please share this message. There's too many people out there that don't know that they can be helped, and they're struggling with really significant neurological issues like in this case, tinnitus, ringing in the ears, balance issues, nausea, vertigo, migraines, headaches, depression, anxiety, a whole bunch of different stuff that could be due to an injury up here that could be helped naturally, and we can help the body facilitate true healing. Love and appreciate you guys. Reach out if you got any questions. Share this message, please. People need to know.